Good evening. I'm Colonel Sheila Varnado, President of Theta Sigma Omega Chapter. On behalf of Alpha Kappa Alpha Sorority Incorporated and the Theta Sigma Omega Chapter, located in Hattiesburg, Mississippi, and in partnership with the South Mississippi Medical Society, I would like to welcome you to our information forum, where our goal is to provide factual information about COVID-19 and the Black community. We thank you for joining us this evening. We know you will be better informed about COVID-19 after hearing from these knowledgeable Black medical professionals, all of whom we are proud to showcase as sisters in the medical fight against this deadly virus. We encourage you to submit questions and share what you learned this evening with family and friends. We also encourage you, if you have not already been vaccinated, to get vaccinated just as soon as you can. Again, welcome to Let's Talk Facts, COVID-19 and the Black community.
Hi, everyone. It is indeed a pleasure to be with you. Thank you, Madam President. I am Lakeisha Cunningham, and I will serve as your moderator for this presentation on this evening. We are so glad to have you here with us. We are ready to talk about the facts. That's what we're here to do. So without further delay, I would like to introduce the panelists to you this evening. First, we have Ms. Constance Bourne. Ms. Bourne is an epidemiologist for the Mississippi State Department of Health, also known as MSDH. In this role, she has been deeply involved with the COVID-19 data since March 2020. Ms. Bourne also assists MSDH by creating data collection tools such as REDCap surveys to streamline the reporting of COVID-19 specific information for providers in the state. She has experience in communicable diseases as a vaccine preventable disease epidemiologist. She received a Bachelor of Science degree in Biological Sciences and a Master of Public Health with an emphasis in epidemiology and biostatistics, both from the University of Southern Mississippi. We thank you for being with us, Ms. Bourne. Next, we have Dr. Yakila Naylor. Dr. Naylor is a 2005 graduate of Xavier University of Louisiana with a Bachelor of Science degree in chemistry. She attended the University of Mississippi School of Medicine, completed pediatric residency training at the University of Mississippi Medical Center in 2012. Dr. Naylor is board certified in pediatrics and currently serves as a private practice pediatrician in Hattiesburg, Mississippi since 2012. Thank you for being with us, Dr. Naylor. Now introducing Dr. Alicia Stevens. Dr. Stevens is a board certified physician in the fields of internal medicine and pediatrics. She received her Bachelor of Science degree from Prairie View A&M University and then continued her studies at the University of Cincinnati College of Medicine. After obtaining her medical degree, she completed training at Tulane University. She currently works in Poplarville, Mississippi. Thank you for being with us, Dr. Stevens. And we also have with us Dr. Joanna Stewart. Dr. Stewart is a proud alum of Hattiesburg High School 2002 and Xavier University of Louisiana 2006. She attended the University of Mississippi Medical Center and completed internal medicine residency training at the University of Tennessee Health Science Center in Memphis, Tennessee. She currently works as a hospital medicine physician at a local hospital. Dr. Stewart is board certified in internal medicine. So, as you can see, we have an esteemed group of people on the panel, and we are excited to hear what they have to say in helping our community. So we thank you for all being here once again. So let's not delay any further. Let's talk facts. First, we will have our first panelist will be Ms. Bourne.
Thank you, Dr. Cunningham. So let's begin. Coronavirus. Coronaviruses are a large family of viruses that can cause illness in animals or humans. In humans, several known coronaviruses can cause respiratory infections, ranging from the common cold to more severe diseases such as severe acute respiratory syndrome, also known as SARS, Middle East respiratory syndrome, also known as MERS, and coronavirus disease 2019, known as COVID-19. Next slide, please. What we know about COVID-19. Infection with COVID-19 can result in a range of illnesses, from mild symptoms to severe illness and even death. We don't know how COVID-19 will affect each person. Some people are more likely than others to become severely ill, such as older adults, 65 years and older, or people with certain medical conditions. Next slide, please. COVID-19 pandemic in the USA, cases continue to rise. Here we have a map of the United States as it depicts COVID-19. As of January 22nd, 2021, there were approximately 24.5 million cases of COVID-19, with the addition of approximately 200,000 new cases being added. There have been approximately 400,000 total deaths, with the addition of approximately 4,000 new deaths. Next slide, please. COVID-19 in Black communities in Mississippi. As of February 19, 2021, there have been 290,242 total cases of COVID-19 in Mississippi, with approximately 78,000 of the cases being from Black non-Hispanics. There have been 6,553 total deaths in the state, with approximately 2,200 deaths being from Blacks. Blacks make up 27% of the COVID-19 cases and 34% of the deaths. Next slide. COVID-19 impacts the Black community more severely. Blacks or African Americans are 1.4 times more likely to be infected with or have a case of COVID-19 compared to white persons, 3.7 times more likely to be hospitalized, and 2.8 times more likely to die from COVID-19 than their white counterparts. Next slide. Reasons for COVID-19 health disparities in the Black community. There is increasing evidence that Blacks are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of health and quality of life outcomes and risk. To achieve health equity, barriers must be removed so that everyone has a fair opportunity to be as healthy as possible. Some of the many inequities in social determinants of health that put Blacks at increased risk of getting sick and dying from COVID-19 include discrimination. Unfortunately, discrimination exists in systems meant to protect well-being or health. Discrimination, which includes racism, can lead to chronic and toxic stress and shape social and economic factors that put Blacks at increased risk for COVID-19. Next, we have healthcare access and utilization. People in the Black community are more likely to be uninsured than whites. Blacks may hesitate to seek care because they distrust the government and healthcare systems responsible for inequities in treatment, and historical events such as the Tuskegee experiment of untreated syphilis in the African American male, and sterilization without people's permission. Next, we have occupation. Blacks are disproportionately represented in essential work settings such as healthcare facilities, farms, factories, grocery stores, and public transportation. Some people who work in these settings have more chances to be exposed to the virus that caused COVID-19 due to several factors, such as close contact with the public or other coworkers, not being able to work from home, and not having paid sick days. Lastly, we have housing. Blacks and other people of color live in crowded conditions that make it more challenging to follow preventive strategies. In some cultures, it is common for family members of many generations to live in one household. In addition to growing and disproportionate unemployment rates of Blacks during COVID-19 pandemic may lead to greater risk of eviction and homelessness or sharing of housing. These factors and others are associated with more COVID-19 cases, hospitalizations, and deaths in areas where Blacks live, learn, work, play, and worship. Next slide, please. Mississippi State Department of Health vaccination reporting. As of February 14, 2021, there have been 442,874 total doses of vaccines administered. 72% of vaccinations, which is approximately 256,000, have gone to whites, and 20%, which is about 72,000, have gone to Blacks. Blacks make up 38% of the population here in Mississippi, but only 15% of Blacks have been vaccinated, while whites make up 57% of the population and 71% of whites have been vaccinated. Next slide. Intention to be vaccinated varies by group. This data shows the percent of US adults who say they would definitely or probably get a vaccine for COVID-19 if one were available today. Only 42% of African Americans intend to get the COVID-19 vaccine, while 61% of whites intend to get the COVID-19 vaccine. Next slide. Reasons for COVID-19 vaccine hesitancy in the Black community. Here are a few questions and reasons why there is hesitancy to get vaccinated among the Black community. Some people are wondering, is the vaccine safe? What are the long-term and short-term effects? How much does it cost? How can I access the vaccine? Was the vaccine rushed? Can I trust it? Remember the Tuskegee syphilis experiment and Henrietta Lacks. Is all this made up? Next slide. It has been stated that COVID-19 is an invented pandemic to cover up the effects of 5G radiation. That's a myth. The fact is, COVID-19 is a real disease that has affected the lives of millions worldwide, and there is no connection between 5G technology and the COVID-19 pandemic. 5G is the 5th generation mobile network being rolled out across the United States. The belief that COVID-19 and 5G are connected comes from a long-standing myth that wireless signals can sicken people, specifically with electromagnetic sensitivity, or that they may weaken their immune system, but there is no evidence to support these claims. Next slide. Another myth is that people think Black people can't get COVID-19. That's a myth as well. The fact is, in America, Blacks are experiencing more serious illness and death from COVID-19. 55,580 Black Americans are known to have lost their lives to COVID-19 through Tuesday, January 5th, 2021. Nationwide, Black Americans have experienced approximately 17% of all deaths of known race, but they represent 13% of the population. Next slide. Another myth is that people think they have to pay for the COVID-19 vaccine, and they don't. The fact is, per CDC, the COVID-19 vaccine will be free for you. The federal government is providing the vaccine free of charge to people living in the United States. However, your vaccination provider may bill your insurance company, such as Medicaid or Medicare, for an administration fee, but otherwise the vaccine is free.
Happy to
I'm
be
sorry.
here.
I just realized I was muted. I'm sorry. Next, we will have, thank you, Ms. Bourne, for that presentation. Next, we will hear from Dr. Stewart. May I also remind you all that you please to share the link so this information can be given out to our community so we can help each other. And also, you feel free to write any questions in the chat box, and we will address the questions at the end of the presentation. Again, next we will have Dr. Stewart. Let's talk facts.
Thank you, Dr. Cunningham. I'm happy to be here, everyone. So currently we have 2 vaccines available that have received emergency use authorization from the FDA. Those 2 vaccines are the Pfizer, BioNTech, and the Moderna vaccines. The Pfizer vaccine is about 95% effective at preventing symptomatic COVID-19 infection after the second dose, and the Moderna vaccine is about 94% effective. These are 2-dose or 2-shot vaccines. With Pfizer, you get the second dose 21 days after the first, and with Moderna, the second dose comes about 28 days later. There is another vaccine that you might hear about later, and that's the Johnson & Johnson COVID-19 vaccine. It works differently than Pfizer and Moderna. It's a single shot, and it uses a different delivery system, something called adenovector. It's not an mRNA vaccine, but we won't get into that during this presentation because they have not yet received their emergency use authorization. But I do want you guys to be aware of it because they have applied for it, and it might get approved in the coming weeks to months, which is why I mentioned it to you. But as for now, we have 2 very good vaccines in Pfizer and Moderna, which again are 95 and 94% effective. In order for these vaccines to receive emergency use authorization, they had to prove that the known and potential benefits outweigh the known potential risk. Any vaccine or medication that receives emergency use authorization has been thoroughly vetted. And these COVID-19 vaccines have gone through the same process. So I want everyone to remember that there have been no shortcuts taken and that they have been held to the same safety standards. Next slide, please. So this is very important information in terms of understanding how we get to the point of even having these vaccines available to us today. How do they get the data to present to request for emergency use authorization? That information and data comes from clinical trials. You've heard people in the news talk about clinical trials, and what you see here on this slide is the 4 phases of clinical trials, which is a part of that safety vetting process that we talked about on the last slide. The progression of this process starts in the science lab. Then promising treatment is administered to a small group, and as the results show effectiveness and a lack of side effects, it's expanded to more and more and more people. To make a long story short, in the case of Moderna and Pfizer, once they noted in their phase 3 clinical trials that those who got the vaccine did better than those who didn't get it, and that the vaccine protected people from disease, illness, and that there were no serious safety concerns, then they had enough data to apply for their emergency use authorization. And even now, they are still carefully studying and collecting data on the vaccine's long-term benefits and side effects. Next slide, please. This portion is very important. There's so much fear and rumors rooted in people's lack of understanding behind how the new mRNA COVID-19 vaccines work. We have never had any mRNA vaccines before to protect us from any disease, before the 2 that we currently have now with Pfizer and Moderna. So I think in our community, because it's the first time this type of vaccine has become available, some people have been paralyzed by fear because we don't understand it and don't trust it, or some have even fallen victim to misinformation on the internet or social media. But it's really important that you know the facts for yourself about how these vaccines work. And I believe that once we all have a proper understanding, then you will see, like I did, that the vaccine and the science behind it is pretty cool and that it's also very safe. So the first thing that I want you to know is that while mRNA vaccines are new, the technology and the science is not new and has been studied for several decades. mRNA stands for messenger ribonucleic acid, and in the case of Pfizer and Moderna, mRNA vaccine, simply put, the vaccines send a temporary message or instructions to make a protein in our bodies that looks like the spike protein that's found on the virus. You see the name here, SARS-CoV-2, and that's the scientific name for the virus that causes COVID-19. These red spikes that you see here on this model is the spike protein, and that's what the virus uses to attach to our cells. By itself, the spike protein is harmless, and these mRNA vaccines give instructions on how to make a copy of this harmless protein so that our body recognizes these proteins as foreign and then triggers an immune response that produces antibodies. These antibodies basically are primed and ready to protect us if we later encounter the real coronavirus, and they attack and destroy the virus before it has a chance to make us sick. This is the benefit of vaccination, because if you do encounter the virus, you have an arsenal ready to fight off the virus for you. The risk of not getting vaccinated is that it might take your immune system weeks to try to produce an immune response. And lots of people get really sick, end up hospitalized, or die from COVID-19 while their immune system is trying to build up the antibodies it needs to fight off the virus and win, versus getting one of these available COVID-19 vaccines, which help to protect us by creating an antibody response without us having to get infected and sick and possibly die. It's also important to note that these mRNA vaccines do not contain any live virus, so there is no way that you can get COVID-19 from them. Again, they simply contain instructions or a temporary message via the mRNA that teach our body how to make a copy of the harmless spike protein. And again, it does not contain any live virus. The last thing on this slide that's important to note is that these mRNA COVID-19 vaccines do not interact with your DNA. The mRNA is very fragile, it's short-lived, so in the case of these vaccines, once it gets the message to our bodies to make the spike protein, the mRNA is destroyed, so it never interacts or changes our DNA, which is a common myth about mRNA vaccines. The mRNA from these COVID-19 vaccines never even enters the nucleus of our cells, which is where our DNA lives. So again, it cannot affect or interact with our DNA in any way. Next slide, please. Many people have been wondering how COVID-19 vaccines could be developed so quickly without sacrificing safety. The main thing that I want you to know about this is that they started producing and manufacturing the vaccine before they had all the data and science to prove that it really worked. Because of the crisis of the pandemic, they invested millions and millions of dollars on the front end. And that's how we were able to get the vaccines in such an accelerated length of time. Next slide, please. So I wanted to include this information just to really highlight the diversity of participants involved in the clinical trials. Some people might have some concerns and questions, wondering did they have enough minority participation in the clinical trials? Did they study this on enough Black folks? And you see here that with both the Pfizer and Moderna trials, they had about 10% African American participation. I would imagine, and this is just my opinion, just my speculation, that there might not have been enough minorities volunteering to enlist in these clinical trials early on. So I personally feel that 10% participation, despite these challenges, is quite adequate, considering that in the United States, African Americans make up about 13% of the population. But I really wanted to highlight that they had what I consider to be enough minorities in these clinical trials to make their determination that it's safe and that it works. Next slide, please. Again, the vaccines available now from Pfizer and Moderna require 2 shots. With Pfizer, 2 doses are given 21 days apart, and with Moderna, the 2 doses are given 28 days apart. I know there has been some news recently about possibly doing 1 shot for these vaccines, but this has not been supported by the manufacturers of the vaccine, and it's also not supported by the CDC at this time. So the current guidance is 2 shots for these vaccines. And I want you guys to think about it like this. The first shot primes your immune system and will give you about 50% protection after 2 weeks. The second shot will strengthen your immune response and will give you about 94 to 95% protection 2 weeks after the second shot. So it's very important that you complete the vaccination process with the 2 shots in order to get adequate protection. You also need to be aware that these vaccines are highly reactogenic, so you will probably develop some mild symptoms after vaccination, but this is to be expected. Most people experience symptoms after the second dose, but some people have reported some after the first. Common side effects might include a sore arm, fever, headache, muscle aches, fatigue, or weakness. But these symptoms, again, are usually short-lived and go away in about a day or two. Personally, the day that I got my second shot, I felt extra tired, but by morning, I felt fine. So this is just something to be aware of. I don't want anybody who's contemplating getting the vaccine to be fearful of these mild symptoms. The majority of people do quite well with it, so please don't let a sore arm or a headache stop you from getting vaccinated. Like I said before, these are temporary symptoms that not everyone gets, and it's an expected immune response to vaccination if you do develop it. Next slide, please. Again, this is just showing that there were no significant safety concerns noted during these vaccine clinical trials. They collected at least 8 weeks of safety data after the second dose in the trials. Obviously, they have a lot more data now. It's unusual to develop vaccine-related side effects more than 8 weeks after vaccination. And this just tells us again that these vaccines are safe and that they are continuing to monitor for any safety concerns. Next slide. So this information is important. Please don't get lost in the words. Read along if you want to, but really just listen to me, okay? I wanted to include this because I wanted us to confront this fear together. I know that there are a lot of people who are afraid of having a severe allergic, severe anaphylactic reaction to the vaccine. But I have to tell you that this is extremely rare. For those of you who might be reluctant to get the vaccine because you are afraid of this, I want you to know the numbers and the facts. Based on data from December 14, 2020 through January 18, 2021, out of the millions of vaccines that have been given, the anaphylaxis rate for Pfizer was only 4.7 cases per million doses administered. And for Moderna, it was 2.5 cases per million doses administered. So that's really not a lot. And also, it's important to note there have been no deaths related to anaphylaxis after vaccination. Again, they have not reported any deaths related to anaphylaxis after vaccination. Most of the reported anaphylaxis reactions that have been reported were in people who had a history of severe allergic reactions and anaphylaxis in the past. So again, just talking facts, if you've never had an anaphylactic reaction before in your life and you don't carry around an epinephrine pen, you are probably very unlikely to develop an anaphylactic reaction to these vaccines. The CDC has listed some guidance, and they do state that the vaccine is contraindicated, meaning should not be given to people who have a severe allergic or anaphylactic reaction to the vaccine or vaccine components. In other words, if someone gets the vaccine shot, the first shot, and they have an anaphylactic reaction or a severe allergic reaction, which we would know because after you get vaccinated, you're monitored for 15 or 30 minutes, then they cannot get the second shot. Also, anyone who is allergic to PEG or polyethylene glycol, which is a component of both vaccines, the Pfizer and Moderna, or polysorbate, which is like a cousin to PEG, although it's not in the vaccine, but it's closely related, then they should not get the vaccine either. Please note that food allergies, environmental allergies, medication allergies, latex allergies, those are not listed here. So I'll say it like this, because people have come to me with this concern and had lots of questions about this. If you are allergic to penicillin, sulfa drugs, lisinopril, peanuts, strawberries, seafood, latex, etc., if it's not an allergy to the vaccine itself or a component of the vaccine, which we'll talk about in another slide, then you're probably okay to get vaccinated. Next slide, please. There are robust systems in place that have been around for decades to monitor and ensure the safety of vaccines. The one I want to highlight is called vSafe, which is essentially a text-based messaging safety system that you can sign up for after you get vaccinated that monitors your symptoms. This is just another example of just how important safety monitoring is. No shortcuts on vaccine safety have been taken for these new COVID-19 vaccines. Next slide. Again, this information is just helping to build the case that even though the vaccine timeline was fast-tracked, safety has not been compromised. Before the vaccines were authorized, the data was carefully reviewed by the FDA and the Advisory Committee on Immunization Practices, which is an independent body of experts. After these vaccines receive authorization, as previously mentioned, the FDA and CDC continue to monitor vaccine safety and side effects. Next slide. Myth. Okay, so this is the fun part. Myth. These studies can't be trusted because they were not designed with Black people in mind. Not enough Black scientists and doctors involved in making decisions about the safety of these vaccines. The fact is, Black scientists and physicians have been involved in developing and studying the safety and making decisions regarding the new COVID-19 vaccines. In fact, the National Medical Association, which is the oldest professional society of Black doctors in the country, decided to form its own independent review of the clinical trial data with Black experts and doctors, and they have also concluded that these vaccines were safe and effective. Next slide. Myth. Getting the COVID-19 vaccine will make me sick and give me COVID-19. The fact is that you can't get COVID-19 from these vaccines because, as we mentioned before, they don't contain live virus. Remember, you only have about 50% protection 2 weeks after your first vaccine shot and 94 to 95% protection 2 weeks after the second. So it is possible to get COVID-19 in between the first and second shots if you're exposed to the virus. But again, you can't catch COVID-19 from getting the COVID-19 vaccine. Next slide. Myth. The new COVID-19 vaccines cause Bell's palsy. This is not true. The fact is, Bell's palsy has not been linked with COVID-19 vaccination, and this is just false. Now, this was a rumor that I heard a lot of early on that's been circulated quite heavily on the internet and social media. So Bell's palsy is a partial facial paralysis that can cause one side of the face to droop or feel weak. There has been no evidence to suggest that COVID-19 vaccine causes Bell's palsy. There were a couple of cases reported during the clinical trials, but the rate of reported cases did not exceed what would be expected already in the general population. So there's been no link between getting the vaccine and getting Bell's palsy. They have not determined that the vaccine causes Bell's palsy. So that's a rumor. Next slide. Myth. COVID-19 vaccine will make me test positive for COVID-19. The fact is, mRNA COVID-19 vaccines will not cause you to test positive on a viral COVID-19 test. If you have a positive COVID-19 viral test after you've gotten vaccinated, then that means that you have an active coronavirus infection, and you should take the proper precautions and seek the appropriate medical treatment if needed. Now, the antibody tests are a different story, and obviously we expect a fully vaccinated person to produce antibodies, but a positive antibody test can also indicate a previous infection. But as it relates to the vaccine and antibody test, experts are still looking at exactly how vaccination may affect antibody testing results. Next slide. Myth. These COVID-19 vaccines can't be safe because they were made too quickly. The fact is, the science behind the mRNA COVID-19 vaccines existed before the pandemic, but was urgently developed because of the pandemic. Operation Warp Speed funneled millions and millions and millions of dollars into vaccine production. And as I mentioned before, because of the critical nature of the pandemic and how many people were dying, the vaccines were produced before we had all of the data to support just how well they really worked. Next slide. Myth. The COVID-19 vaccine will alter my DNA and implant a tracking microchip. The fact is, there is no microchip. The COVID-19 vaccines currently available today are mRNA vaccines, and as we discussed before, they cannot alter your DNA. I think it's important that you know the basic components of the mRNA vaccines because there is so much misinformation out there. So understanding the basic components, I feel, will help to dispel some of these myths. The vaccine is made up of essentially 4 main parts. 1, mRNA, which gives the instructions on how to make a copy of that spike protein. 2, fats, lipids, or PEG. 3, salt, and 4, sugar. You see there's no tracking nanochip in the vaccine. I also want to mention for the people who are concerned about their food, environmental, antibiotic, medication allergies, you can see for yourself here that none of those components are listed in the vaccine either. In order to have an allergic reaction, you have to be exposed to an allergen. And you see there's no eggs, peanuts, tree nuts, penicillin, sulfur, lisinopril, etc. in these vaccines. So if you are allergic to eggs, nuts, penicillin, lisinopril, sulfur drugs, etc., that does not make you allergic to the COVID-19 vaccine. So you're good there and okay to get vaccinated. Thank you.
I don't know about you, but I feel so good just after hearing the first two panelists. I'm excited to hear what else we have to talk about. So next we'll hear from Dr. Naylor. Again, please post any questions you may have. We will address them at the end of the presentation. And it is still not too late to share the link. So let's move forward. It's on to you, Dr. Naylor.
Thank you, Dr. Cunningham. Good evening, everyone. Okay, the COVID-19 vaccine in children. So under the current emergency use authorization, the Pfizer vaccine is authorized for use in ages 16 and up, and the Moderna vaccine is authorized for use in ages 18 and up. Any children and adolescents outside of these age groups should not receive the vaccine at this time. Both companies, both Pfizer and Moderna, have already begun testing the vaccines in kids as young as 12 years of age. Pfizer began enrolling ages 12 to 15-year-olds in October of last year, and Moderna started their trial in 12 to 17-year-olds in December of last year. These trials that they that are undergoing will help to determine if the vaccines are safe and effective in those age groups. Next slide, please. So both companies, they will begin studying their vaccines in ages 5 to 11-year-olds after the results of the adolescent trials that we just mentioned are available. Both companies hope to have enough data from their adolescent trials by this spring. And if all goes well there, then they both predict that their vaccines could be authorized for use in 12 to 17-year-olds before the beginning of the upcoming school year. But we don't expect a vaccine for kids under 12 years of age before later this year or possibly early next year. Next slide, please. Myth: children are immune to COVID-19 and can't spread it to others. Facts: so it is true that fewer children have been sick with COVID compared to adults, but children can spread the virus to others. It is also very important to remember that children with COVID-19 who are asymptomatic, meaning not showing any symptoms, they can still spread the virus to others as well. But most children who get COVID have mild symptoms, but some can get severely sick, severely ill. Next slide, please. How does COVID-19 affect kids? The symptoms of COVID-19 in kids are similar to symptoms in adults, actually. And COVID-19 in kids can look like common illnesses such as the common cold, such as strep throat, or common allergy, seasonal allergy type symptoms. The most common symptoms in kids are fever and cough, but as we see listed here, some other symptoms that we see in COVID-19 in children: runny nose or nasal congestion, loss of taste or smell, sore throat, shortness of breath or difficulty breathing or any respiratory difficulties, GI symptoms such as nausea, vomiting, or diarrhea, stomach ache, abdominal pain, fatigue, headache, body aches, or any poor appetite or poor feeding that will be in children under or infants younger than 1 year of age. Next slide, please. How to prevent the spread of COVID-19 infection in kids. The answer to that question is we must vaccinate every eligible adult to help lead to herd immunity. So that's the best protection we have right now for our kids. That's the best defense we have right now for our children against COVID-19. So what is herd immunity? That is when we have a high percentage of the community, when a high percentage of the community is immune to a disease, making the spread of the disease unlikely. So how does this percentage of the community become immune to the disease? That is through having been vaccinated against a particular disease or having had a prior illness with this disease. So what this means is, this means that individuals who have not been vaccinated in these communities, such as our children, as we're talking about here, they are offered some protection because the disease has little opportunity to spread within the community. So we need to vaccinate every eligible adult. That's the only defense we have right now for our children and protecting our children against COVID-19. Next slide, please. COVID-19 vaccine in pregnancy and breastfeeding. So what we do know is that pregnant women are at an increased risk for severe illness from COVID-19 compared to non-pregnant women. And the American College of Obstetricians and Gynecologists are recommending that the COVID-19 vaccine be offered to pregnant women and breastfeeding moms who meet criteria otherwise for receiving the COVID-19 vaccine. Based on what we know, as Dr. Stewart said earlier, on how the Moderna and Pfizer or the mRNA vaccines work, experts believe that the vaccines are unlikely to pose a risk for breastfeeding women, the developing placenta, and to the breastfeeding infant. So again, ACOG, the American College of Obstetricians and Gynecologists, are recommending the COVID-19 vaccines to pregnant women, breastfeeding moms, and so forth. Next slide, please. Myth: the COVID-19 vaccines cause infertility. The facts: the COVID-19 vaccines have not been linked to infertility or to an increase in miscarriages. There is no evidence that the antibodies formed from the COVID-19 vaccine cause any problems with pregnancy or the placenta. We do know that pregnant women are at increased risk of hospitalization or severe illness from COVID, as I've said, but there is no evidence of an increased miscarriage rate. So if we kind of go back to what Dr. Stewart said earlier and how the vaccine works. So we know that during natural infection with COVID, the immune system generates the same antibodies to the spike protein that the COVID-19 vaccine would generate. So if COVID-19 affected fertility, so if the actual virus affected fertility, we would already see an increase in miscarriage rates in women who have developed COVID-19 during pregnancy. And this is simply has not been the case. There has not been an increased risk in miscarriage rate reported in pregnant women who have contracted the virus while pregnant. Next slide, please. COVID-19 and the symptoms. So it's very important that we know the symptoms. And as I said earlier in the slide, as the symptoms pertaining to kids and children, in general, cough, shortness of breath, difficulty breathing, any respiratory difficulties, fevers, chills, muscle or body aches, GI symptoms such as nausea, vomiting, diarrhea, abdominal pain, and especially any new loss of taste or smell. Next slide, please. COVID-19 testing. If you have any concern that you may have COVID-19, especially if you've been exposed, then please just go get tested. Do not delay. Go get tested. There are several free local resources available to get tested. There's drive-through testing. It's a lot more convenient now to get tested. So if you have any concern about feeling ill, the possibility of it, again, COVID can look like the common cold. It can look like strep. It can look like the flu, other viruses or other infections. So if there's any concern, please go get tested. Next slide, please. Myth. I tested positive for COVID-19, so I only need to self-isolate for 7 days. The facts. Self-isolation can be ended after 10 days, and you have not had any fever for 24 hours. So that 10th day, you've been fever-free and other symptoms are improved. If you have been asymptomatic with the virus, then isolation will end at 10 days after 10 days of your positive test. So if you tested positive then, but you were asymptomatic, then you can end isolation after 10 days. What is the difference between self-isolation and quarantine? Self-isolation means you are in isolation because you have the virus and you're isolating to prevent from spreading the virus to someone else. When you're in quarantine, you are quarantining because you might have been exposed to the virus and you're isolating yourself to keep from spreading it to someone else. So self-isolation, you have the virus, and quarantine, you are isolating because you might have been exposed to someone with the virus. And both are required by the Mississippi State Department of Health. So the Mississippi State Department of Health strongly encourages a full 14-day quarantine, especially if you have a close household contact who's been infected with the virus. However, there are two alternative quarantine options. There's a 10-day quarantine option, and then there is a 7-day quarantine option. So the 10-day quarantine option means that you can end your quarantine after 10 days if you have been asymptomatic for the entire 10-day period. You have not had any symptoms each of the 10 days. The 7-day quarantine option, as it says with the test, means that, again, you have not had any symptoms for 7 days, but you also have to have a negative PCR test on the 5th, 6th, or 7th day of your quarantine. The PCR test is not the rapid test, not the 15-minute, 30-minute test, the test that we say we send out to a lab somewhere else. You have to have been swabbed. The specimen has to have been obtained on the 5th, 6th, or 7th day of your quarantine. And once that returns, then you may end your quarantine after 7 days. Next slide, please. I tested positive for COVID. Now what? Stay home to try to prevent the spread to others. Get rest, stay hydrated, have your over-the-counter medicines handy to help you feel better, your fever-reducing medicines, and stay in contact with your doctor. If you have any new worsening symptoms, don't hesitate to call and talk to your doctor about it. Let them know how you're feeling. And again, separate yourself from other people as much as possible to prevent the spread. Next slide, please. This is kind of a little bit of what the previous slide said. If you have possible or confirmed COVID, again, stay home, isolate, monitor your symptoms, try to stay tuned with your body, talk to your healthcare provider. If you have any new or worsening symptoms, stay hydrated, try to eat, try to rest. If there's an emergency, don't hesitate to call 911 to seek medical attention. And while you're in your home, while you're isolating, try to do what the best you can to prevent, to cover your nose, your mouth when you cough, when you sneeze. Wash your hands as often as possible. Stay in a specific room if there's others in your home to try to prevent the spread from them. When you have to come out of that particular room, wear a mask and try to avoid sharing personal items such as dishes or bedding or towels. And then just everyday precautions, clean all surfaces, especially the surfaces that are touched often, like countertops, doorknobs, and so forth. Next slide, please. I have a negative test for COVID, but I still feel sick. If you tested negative for COVID, then one of two things. Possibly you were not infected at the time the sample was collected. It was possible that you were just early when the sample was collected or when you were tested. But it's you could still test positive later in a few days. So a negative test result does not mean you won't get sick later. Next slide, please. Myth: you should avoid the hospital if you're really sick and avoid going to you and your child's routine doctor's appointments if you want to stay healthy and not catch COVID-19. The facts: don't delay going to see your doctor or going to the hospital if you feel you need to do so. If you delay getting checked out for whatever the condition may be, this may just worsen your other chronic or your other medical problems, whether it be chronic or acute. So continue to see your primary care doctor for routine follow-up appointments for your other conditions. Also, it is extremely important for children to remain on schedule for their well child visits and their routine childhood vaccines. Next slide, please. I had COVID-19, so I don't need to get the COVID vaccine. That's a myth. The facts: you should still get the COVID-19 vaccine if you've had the virus. Right now, it is not known exactly how long we or an individual has protection or natural immunity after having the virus. This varies from person to person. So even if someone has had the COVID-19, it is possible they can get COVID-19 again. So we should still get the COVID-19 vaccine once we are asymptomatic, once we are out of the required isolation quarantine time. Then we should still go ahead and get the COVID-19 vaccine. Next slide, please. Myth: spikes in COVID-19 cases are because of increased testing. The facts: the spikes are not related to increased testing. What is more concerning to us is the percentage of positive results. That means that the virus is spreading more rapidly. Testing helps us know when to self-isolate or quarantine. So testing is very, very, very important. It also allows the local health departments to make decisions and to monitor the spread of the virus. And then this helps them, meaning the State Department of Health, make decisions or recommendations about our schools, our churches, our businesses, and our day-to-day lives. So COVID-19 testing is very important. And again, if there is a spike in cases, it is due to, or what is more concerning, I should say, is when the percentage of positive results is higher, above a certain percentage. That is what's concerning, because that lets us know the virus is spreading more rapidly. So testing is very, very, very important in helping control and this virus. Thank you.
Thank you, Dr. Naylor, for that information. Next, we will have Dr. Stevens.
Thank you and good evening. Now, what do we do with all this wonderful information provided by my esteemed colleagues? Well, most importantly, get vaccinated. This will decrease the risk of serious illness and the spread of the COVID-19 virus. Also, we need to continue to use our masks properly, hand wash, and social distance. This will also help reduce this curve and help us move past this pandemic sooner. Next slide. Myth: I'm not at risk for severe complications from COVID-19, so I don't need to get vaccinated. The facts are vaccines are for everyone, regardless of their personal health status, because COVID deaths have occurred in all age groups with or without prior medical conditions. Also, I'll stress again, vaccinations protect not only the vaccinated person, but everyone else in the community. Next slide. Myth: vitamin D helps to prevent and cure COVID-19. While vitamin D is an important molecule for our immune system and support of it,
It is not a preventive measure to protect anyone from getting COVID, and it does not serve as a measure to cure COVID. Your primary care provider can discuss this with you further and also possibly check your vitamin D level so that you know your status. Next slide. Myth: drinking lots of water will flush COVID-19 from my body. Well, since COVID is introduced through the respiratory system, this is in fact a myth. The fact is that drinking water will have no impact on infection risk. Water, although great for hydration, has no specific impact on whether or not you will get ill from the COVID virus. As it specifically relates to COVID, water's best use is in frequent hand washing. Next slide. Speaking of hand washing, let's review the proper technique. First, you should wet your hands with water, then apply the soap, making sure that you lather all surfaces of your hands, front, back, and in between your fingers. You want to wash and lather while singing the happy birthday song 2 times. Be sure also to clean under your nails. Next, rinse and dry with either an air dryer or disposable towel. Next slide. Mask wearing is very important. You want to make sure that you wash your hands before you apply your mask and after you take it off. You also want to make sure that you wash your hands when you cough or sneeze or blow your nose. And of course, during the usual times of after eating and before and after eating, and after assisting or going to the restroom yourself. But proper mask technique is also important, along with staying 6 feet apart as part of our social distance recommendations and avoiding crowds whenever possible. Next slide. So let's discuss proper mask wearing technique. Your mask should cover your entire nose and mouth. It should fit snugly across your face with no gaps, and the fabric used should at least be 2 layers. At no time should you slide the mask onto your forehead or down to your chin. Next slide. Neck gaiters can be an acceptable alternative, as long as they too fit snugly and are at least double layered with fabric. Face shields, however, have not been shown to be beneficial. For children, use a proper child-sized mask for any child who's 2 years old or older. To help them get comfortable, here are a few suggestions. First, have them wear it around the house for a few minutes at a time. Next, try to make a game of it. Children do enjoy games. So challenge them to see who can keep their mask on longer. Another thought is that children tend to like to be helpful. So explain to them that wearing their mask helps them keep everyone safe. Fourth, allow the child to pick out their own design for their mask. Try different ones. Some children prefer the ones that tie behind their heads, while others prefer the loops around their ears. Giving them some choice helps them be less resistant. Next slide. Myth: wearing a mask will increase the amount of carbon dioxide I breathe or lower my oxygen level and make me sick. The fact is, studies have shown no increase in carbon dioxide, which is what we breathe out, with mask wearing. Because carbon dioxide molecules are much smaller than the droplets that carry the COVID-19 virus, carbon dioxide can pass easily through the mask. Next slide. Myth: I'm not sick, so I don't need to wear a mask. Wearing a cloth mask will not protect me from getting COVID-19. The fact is, studies have in fact shown that there are a fair number of people with COVID who never express any symptoms, and thus can spread the infection without knowing it. Additionally, people who are infected and do later present symptoms will have a few days where they are also asymptomatic or without symptoms. Therefore, mask use greatly decreases the risk of contracting and spreading the virus when worn properly. Next slide. Myth. The COVID-19 vaccines won't protect you against these new virus strains, so why bother? Fortunately, the vaccine developers designed the vaccine knowing that viruses do mutate. So each vaccine has been made so that the body will produce antibodies to multiple portions of the virus. Viruses, when they mutate, generally only mutate in one particular location. Thus, the vaccine remains helpful and effective because the body has been challenged to develop antibodies to other portions of the virus that have not changed. Next slide. I want to get vaccinated. So what do you expect before, during, and after? Well, first, you're taking a first important step here by listening to this presentation and getting the facts. Talk with your medical provider about any further concerns, and then learn how to get vaccinated. Most state health departments have a database of locations and information on how to get vaccinated as well. During your vaccination appointment, you will be given the COVID-19 fact sheet. You will also be given a vaccination recording card that has the information about the particular vaccine that you received. You will be asked to sit for up to 20 to 30 minutes so that you can be monitored for any immediate side effects. You will also be given information on the VSafe program. After your vaccination, please register for the VSafe program so that they can continue to monitor for any other potential side effects. Continue to wear your mask, socially distance, and hand wash. Next slide. So in conclusion, get vaccinated. It is the best way that we have to get over this pandemic and to reduce the curve. Wear your mask, socially distance, hand wash regularly, and talk to your friends, family, and acquaintances about what you've learned. Thank you for spending part of your evening with us. And now I'll turn it back over to our moderator, Dr. Cunningham.
Thank you, Dr. Stevens, and thank you once again to all our fine panelists. You all have done a great job. I feel so much better about all of the information that has been given out, to the useful information that's been given out, how it will help us as individuals and also our community. So I'm quite thankful for our panelists. Now it's time for a little Q&A. So I do see the questions that have been submitted at this time, but we also have some questions that were submitted previously. So I'm going to take this time to ask our panelists these questions and hear their responses. And again, we thank you all. You ladies did a wonderful job. It was magnificent. And I really do appreciate you all. And I appreciate the information that you have provided for our community. So now let's move forward and go to our first question. Are there certain things you should or should not do after receiving vaccination? I will direct this question to Ms. Bourne.
I'm sorry, I was on mute. There are things we should be doing after receiving vaccination, including using all the tools available to help stop this pandemic. We should continue to cover our nose and mouth with a mask when around others, stay at least 6 feet away from others, avoid crowds, avoid poorly ventilated spaces, and continue to wash our hands often. Thank you.
Thank you, Ms. Bourne. Next question. If I am severely allergic to sulfur drugs, is it wise for me to still get the COVID-19 vaccine? Dr. Stewart, can you address this question, please?
Yes, thank you, Dr. Cunningham. So we covered this a little bit in the presentation before, but if you're allergic to sulfur drugs or penicillin, lisinopril, have food allergies, environmental allergies, these are not contraindications to getting the COVID-19 vaccine. Just want to remind everybody about the 4 basic components of the vaccine, which would be 1, the mRNA component, fats, PEG, salt, and sugar. No sulfur in these 4 things, so you're okay to get vaccinated.
Thank you. Question 3. And let me remind you, some of these things were thoroughly addressed already in the presentation, but we want you to know that we appreciate your questions and your participation, so we'll happily reiterate this information as well. This question is a little lengthy, but very relevant. If you come into contact with a person who has received their second shot of the vaccine and they exhibit flu symptoms, are you susceptible to getting sick? It's a 2-part question. Do we need to social distance from people who have been vaccinated if they show symptoms after the second shot? Dr. Stevens, would you address this question, please?
Certainly. The symptoms that you might be seeing from someone who has already been vaccinated, even if it's only just been 1 dose, may or may not be the flu, frankly. It could be the cold, or it could be some other type of contagious disease. Additionally, the COVID vaccines, as we mentioned before, can take several weeks for you to develop that immunity, and you don't get that 90+% protection until several weeks after the second dose. So any symptoms that they're exhibiting, you should continue to social distance. They should be continuing to wear a mask, as should you, in order to reduce the risk of any potential spread.
Thank you. Next question. Which vaccine is more effective? Ms. Bourne, can you help us with this question?
Yes, Dr. Cunningham. Both the vaccines, the Pfizer and Moderna, are equally effective at 95%. Thank you.
There you go. It works. Number 5, we have another. This is a 2-part question as well. If you received the first dose of the Pfizer COVID vaccine and later you get COVID, what is the recommendation for the next steps? So when we get the second dose of the same vaccine, or do you need the first dose over again, or is it okay to change the type of vaccine or even get the 1 dose when it's available? Dr. Naylor, can you address this, please?
Yes. If you've received the COVID-19 vaccine and if you've received the COVID-19 vaccine and you become infected with COVID shortly afterwards, then the second vaccine should be deferred until you recovered from the illness. That's assuming you were symptomatic. And also the criteria has been met to discontinue isolation. The first dose does not need to be repeated in these situations. And for persons who receive the monoclonal antibody therapy or plasma therapy as part of their COVID-19 infection treatment, then vaccination should be deferred for at least 90 days. The Pfizer and the Moderna vaccines are not interchangeable.
Thank you, Dr. Naylor. The next question is, can someone with an autoimmune disease take the vaccine? Could it make that person go into a flare due to the immune response? Dr. Stevens, will you address this, please?
Sure. At this time, there is no contraindication or reason for anyone with autoimmune disease to not get vaccinated. So you should do so as soon as you're eligible to do so. And there's been no signs or evidence that it will trigger a flare of any sort for anyone.
Great information. Next question. Dr. Stewart, this would be for you. Is the vaccine effective against the new variant? Do all brands of the vaccine work against the new variants that have been discovered? Can you please address that?
Great question. And I know a lot of people have interest in the variants. So basically, the 2 brands that we're talking about are the 2 that have received emergency use authorization, the 2 that you can get today, and that's going to be Moderna and Pfizer. And so far, based off the studies, what we know is that these vaccines produce antibodies that are effective even against the variants. Thank you.
Thank you. Next question. Do you all know how many other variants are known at this time? Dr. Stevens, please.
We don't know how many might actually be out there. Right now, we are aware of 3 main ones. There's the UK variant. There's a variant coming from South America and one from Brazil. But the virus does mutate, so there's a possibility, who knows, if anything will change. But right now, we just have 3. And fortunately, we still seem to have immunity and protection with our vaccines that are available currently.
Thank you. Awesome information. Dr. Naylor, how likely are side effects with each vaccine?
Yes, ma'am. So side effects are likely with the vaccines, but they are normal signs that the body is building protection. Basically, signs that the immune system it's doing what it's supposed to do, responding to the vaccine. The most common side effects are pain or swelling at the injection site, fever, chills, fatigue, or headaches. And the side effects are more common after the second dose.
Stay with me, Dr. Naylor. I have another question for you. Has there been any other studies on women who are in childbearing years? Could the vaccine cause fertility issues?
Yes, so women of childbearing age were included in the studies. And currently, there is no data that shows that COVID-19 vaccines are linked to infertility or miscarriages. Again, no data currently that shows that there is any link between infertility and the COVID-19 vaccines. Of course, studies are they're continuing to follow for more and more information.
Thank you. And actually, Dr. Naylor, another question for you as well. Are the onset of symptoms of the UK variants the same as the original strain?
Yes, so the symptoms of the variants, the symptoms appear to be the same for the variants as the original or initial strains, but the variants seem to be they seem to spread more easily and quickly. That appears to be the biggest difference as of what we know right now.
Okay, thank you. Final question for this evening during this presentation, during this forum. However, may I remind you before I read the last question of the evening for this to our panelists, feel free. We do have some questions that were listed during the presentation, and we're going to address them. Please go to our website, Theta Sigma Omega's website, and we will follow up. We will not ignore your questions because we want to help our community. This is what we're here for. So make sure that you do that. If a question was not addressed, which was posted during the presentation, we will address it later on. So final question as of right now, how exactly does the vaccine work? Dr. Stewart, will you please address this question?
Yes, ma'am. So simply put, for everyone to remember, the 2 vaccines we're talking about again right now available to us are the Pfizer and Moderna mRNA COVID-19 vaccines. And so basically these vaccines work by sending a message via the mRNA to tell our bodies to make a copy of the spike protein that looks like the spike protein on the surface of the coronavirus. Our bodies then recognize that spike protein as foreign. We make antibodies to it. And later on, when we encounter the real virus, we're able to fight it off. That's how the people who get vaccinated are not getting sick and dying from it, because we have an arsenal of antibodies already in our system from vaccination when we encounter the virus. So we encourage everyone to get vaccinated. We hope that we were able to answer your questions. And as Dr. Cunningham said, any questions not addressed tonight, we will get back to you guys at a later time.
Once again, I say thank you to all of our panelists. Thank you for taking this time out to inform our community, impacting our community and making a difference. Please Know that you can share this link if you were unable to see the presentation live tonight. It will be on our website. So please share the link. Please feel free to ask questions. This is what we're here for. This is not just a one-time thing as far as, getting information. These wonderful, intelligent young women are available. They're in our community. They're around us. And it's good for us to know that they're here. We are all here for each other. And thank you again, ladies. It's been an honor to be the moderator for this forum. You all have been great. I will turn it over to Dr. Harris for our closing remarks. Thank you, ladies of Alpha Kappa Alpha Sorority and Theta Sigma Omega, for hosting this event. We are appreciative. Dr. Harris.
I echo this, Dr. Cunningham. Thank you, Dr. Cunningham, for that wonderful job. Thank you again for streaming our forum. Thank you, Ms. Bourne, Dr. Naylor, Dr. Stevens, for the excellent talk. We hope you are more informed about the COVID-19 vaccine. By everyone working together, we can overcome this pandemic. Thank you and good